As you can see, the community is taking the challenge in front of us very seriously. We are all here. Everyone has been working collaboratively on this issue since it became very clear that the COVID-19 would come to our country. I spent the last 4 days in Washington, D.C., meeting with county leaders and executives from across the country. This topic was obviously the large topic where we all were able to actually be in a room and hear directly from the CDC, hear directly from the top-ranking White House officials, and really look and analyze what our plans look like in our communities, and it was very, very helpful. I want to thank the administration and the president and his team for meeting directly with our New York State delegation. Our request was for funding for New York State, and we were very happy that both the president and later on Senator Schumer confirmed that there will most likely be a federal bill passed where $8 billion of funding will be passed on to states, and there will certainly be language that that funding request will then also be passed down to counties. As you can see, we have everyone here that needs to be here at the disposal to really prepare the community for a plan. We will be sharing accurate and timely information with the public at all times, setting up that infrastructure. We're live streaming this event today. This event will be uploaded to the county's website. But certainly over the last 3 days, as I've learned more about the challenge in front of us and how communities are preparing for this, I certainly just want to reiterate, this is not a time to panic. We are very, very well prepared. In Onondaga County, we have a wealth of resources. We are known for our eds and our meds, and certainly our meds are prepared for any challenge that is in front of us. And that's what we've been doing. We've been preparing and planning. We don't just prepare and plan for an event like this when one is in front of us, staring us in the eye. We have a team that does this year in and year out. We do not have any cases of the coronavirus, but like many communities right now, the likelihood is at some point we will have a case here in Onondaga County. In light of this message, it's now the time to take necessary precautions. If you are sick, please go to your primary care provider as you normally would. For businesses and all organizations, we encourage you to review your continuity of operations plans and make sure they are up to date if we see in the event of a community spread in the coming weeks and months. In terms of community spread, we will be reviewing this on a daily basis with our medical teams throughout the community, as well as our emergency management team. Obviously, we're hoping that this does not occur, and we're very happy in some of the communities today, in Oneida County specifically, and in Erie County, it looks like some of the feared cases were not positive tests, so we're very happy about that for our colleagues. But if this does, we will undertake careful review and assess all the options to promote the correct policies, including potential social distancing. For continued information on the virus, we will be continually updating the Health Department website. There is a button on the county's homepage with the most up-to-date information, as well as frequently asked questions that are extremely helpful for the public. We also encourage the public to call 211 if they have any questions or concerns for an immediate nature. This is another great resource that we have at our disposal. We also are certainly accessible to all of our partners who run and manage nursing homes, daycare providers. We'll be meeting later with our school district superintendents for a briefing on this as well, and any other individuals from the medical community that have questions on how to really deal with this threat in front of us.
So based on what we have learned in H1N1 pandemic in 2009, if we could implement these all NPI measures, preventative measures, in a very aggressive and proactive way as a containment effort, we can prevent transmission of infection to a great extent. This is the biggest ask of all of you from where I stand. These three categories of non-pharmacological intervention or prevention strategies are personal protective measures. That means washing hands, staying home if you are sick, covering your mouth, simple things which we talk about during the flu season. Number two, community NPI, what we call it, community preventive strategy, which county executive mentioned. If things do go a little bit serious, social distancing, that comes into the play, and the school closure and dismissal if necessary. And last but not the least is environmental preventive strategies, which include surface cleaning measure. At the lower level, that's what we do when it's a flu season, and it will be different when we have a community transmission. I hope we never do, but that's the thing which we always like to remind. So
Syracuse saw a big outbreak, and the hospitals ran out of capacity. Where would seriously ill patients be diverted to? Does the county have a plan for a secondary location?
Yeah. Look at everything's evolving. I think you're talking about potential surge sites for testing. You're talking about potential isolation sites if folks come in. Right now, we're very lucky we have the infrastructure we do with all of our partners. We don't foresee that being an issue, but that's going to be a conversation with our partners, and a more formal plan will be available at a later date.